you who don't know me, my name is Bernice Toll, and I am the program director for our cancer prevention programs here, which really has been our breast cancer prevention program over the last, I don't know, 7 or 8 years, I think. And we're now moving into being more inclusive of other cancers, screenable cancers that we know exist out there, and our data is demonstrating that we need to do more work in creating it more of a comprehensive model. And as we go through this, you'll see how much more it's expanded. For those of you who have actually been part of our breast cancer prevention programs, you'll see how it's evolved. And for those of you who have not, that's actually not necessarily a bad thing, but you'll see we are actually putting some additional fundings into the program. And we're very excited about this new initiative. And the program is called the Navigating Health Together program, a community-based breast, cervical, and colon cancer prevention screening initiative. All right, Daphne, go to the next slide. And these are the basic housekeeping rules. I don't think we need to go through all of them. Questions, can you drop in the chat, or at the end, we'll be go over and provide answers where I have an actual answer. If I do not, I will find one and provide it to you. And we'll go through this and one of the things is to get on into the iSupplier, and through iSupplier, all of notifications. So any change regarding this RFP will be provided to you once you register. All right, Daphne. So the Chicago Department of Public Health mission is to work with communities and partners to create an equitable, resilient, safe, and healthy Chicago. Our efforts build towards our vision where everyone in Chicago thrives and achieves their optimal health and wellness. So to achieve these objectives, CDPH will invest in the continuum of care for individuals who face barriers to accessing high-quality cancer prevention and healthcare services, with a focus on priority populations, including Black, Latina, and uninsured and underinsured individuals. Actually, this may not be the more up-to-date version. Oh, we'll see. Daphne, go ahead. So the purpose of this RFP is to provide patient navigation and breast cancer screening, cervical cancer prevention, and colorectal cancer screening as well. Previously, the health department has only focused on breast cancer screening, and we're now going to be including cervical cancer and colon cancer screening. So I'm not going to read all of this to you because this all is actually in the RFP. So let's go to the next one. I just want to make sure we have enough time for questions. And I think the budget gets a little tricky, so I want to spend a little time on that. What we have found in terms of the data was that we had a lot of screenable cancers. I think one of our EPIs came up with that term, and it's probably an EPI term. I know Abigail is an epidemiologist. And that we found that despite the fact that there's been so much work done and a decrease in many deaths around cancer, there's still inequities found, especially among our African American and Latino women. Daphne? And where we see a lot of work that still needs to be done is in our breast cancer, and especially around our African American women and Latina women. And so there you have, it's very tiny screen since it's being shot over by Daphne, so I can't see all of this, but as we see, okay, so the triple negative breast cancer. Now there's an area that even in our previous breast cancer programs we did not focus on, and that's the triple negative breast cancer, which we see affect younger Black women, and it grows and spreads more rapidly than any other cancer. So this is an area that we really want any new partner to focus on around the breast cancer, and just in general, but we really want education around the triple negative breast cancer. What we have found in focus groups and and qualitative data is that many women in general don't know about this particular breast cancer. So please keep that in mind as you go around and you write your proposal. Cervical cancer is one of those cancers that women shouldn't die from. It's something that that there's clear ways to prevent it. And in my early days, which takes me way, way back, really back, we all knew that cervical cancer is something that is completely preventable and almost curable. Colorectal cancer, I think we're all seeing that it's coming strong and in much younger people. And so we think, and we know that the data is showing this, and this is an area that we also want to have partners focus on. And you'll see from the actual RFP, and in here, there are specific areas that we want the emphasis made on. Obviously, we still want it to be the population, Black, Latina, uninsured, and underinsured, but we really want all proposals to include why they would be specifically working in certain areas. That being said, we do have priority communities that we absolutely do want education and prevention efforts focused on. Daphne? A lot of this current program, Navigating Health Together, is focused on evidence-based strategies that we have found from CDC and CDC and from other organizations that have been very successful in demonstrating the success between patient navigation, community health workers, and health systems working together to increase screening and decrease mortality around these specific cancers. Of course, all of our work here at the health department incorporates and aligns our CDPH guiding principles around trauma prevention, trauma-informed services. I think cultural responsiveness is really important as well. And the health equity in achieving health equity in all communities. So this is also mentioned throughout the RFP. Daphne? So this next slide is an access to yes. So you may download the RFP at this particular website. If you cannot get to the link or the link doesn't open, please reach out to myself or Daphne and we will make sure that you are able to access this. Now, eligibility criteria is very important for this RFP. You must demonstrate at least 5 years of experience with patient navigation. This actually is not the updated version of the presentation that I made. So I really need you to focus on the RFP. Because there's a lot of eligibility criteria. There are 5 years of experience in working with patient navigation, working specifically with breast, cervical, and colon rectal cancer in the priority populations. In Appendix A in the RFP, the priority populations are listed for your convenience. We obviously need you to be a non-for-profit status, be located in Chicago, and be in good standing with the city of Chicago. This is kind of sounds weird, but if you don't have good standing, that means that you probably have a bill you haven't paid, and nothing will move for you until you pay that bill. So make sure you check with the city that you don't owe a parking ticket or any kind of ticket that they are holding up your good status. So I would definitely make sure that that is happening. Daphne? Yes. Okay, so before we go into this available funding, this is not the presentation. You
I
also
apologize, Bernie. I'm trying to look back in the shared drive
yeah, it's
now.
in that folder, but let me see, maybe I can find it. Just bear with me a second. Sorry. I also saved it down in my computer. I always like to back everything up. All right. Because I need this eligibility criteria to be clear. All right. Yeah, this is the one. Okay. Okay, eligibility criteria. Sorry, y'all.
Are you able to share it? I'm sorry, Bernie.
I'm going to see if I can share it. To slide. Oh, no, wait, I have to.
So
Alrighty.
I stopped sharing so that you could share it.
Okay, let me see if I can share mine. We tried this earlier and Anne-Marie said she could not see it. She could only see a blob. I don't know what's going on.
Now.
You could see it now? Okay.
Yep.
All right.
Awesome.
So, all right. So, all right. So here you go. Yes. All righty. One of the big things we need is, as an eligibility criteria, is you provide evidence of a partnership or intent to partner with either a CBO, or if you're an FQHC, a CBO, if you're a CBO with an FQHC or a health center. But it has to be, we need a letter of intent, a memorandum of agreement, a memorandum of understanding. It will not fly to say simply, we have a partner in the community. We don't have those letters, you will be kicked out of the round. So here, and there we go. Here we go. There you go. You must have the 5 years of clinical experience providing the breast, cervical, colorectal cancer prevention services, as well as 5 years demonstrating community health worker or patient navigation experience. Respondents must have proof of current certification or accreditation through the American College of Radiology, the IEMA, I'm not gonna, and the Quality Standards Act, through the Quality Standards Act. Preference will be given for those agencies that are designated as breast imaging centers of excellence, which in the world of cancer, they're called BICOs. So these are requirements. So if an agency does not have that, or the partnerships, when they come, they will not qualify for this program. So I think this will happen and when partners come together, and I think this is why it's important to partner with the right people. We want real people to come in with real experience. Okay, so Anne-Marie, here's the funding that's available. The funding is a little tricky, so I'm going to go through it slowly. And the grant should start August 1st, the contract period, through December 31st of this year. For this particular initial contract period of August 1st to December 31st, there will be $737,000 available. Up to 4 contracts may be funded, and individuals or agencies that are funded in this, for this RFP, will have up to 3 one-year extensions, which is new for us. I think some of us have been part of the city and have gone through different contracts with the city. It's always been 2. This time we're getting 3 years extensions. Now, of course, those extensions are based on your performance, on the program needs, or overall the available funding the city has. So what we will require is 2 budgets be submitted for this RFP, and the budget periods cover August 1st through December 31st of 2026. Estimated awards will range from $100,000 to $175,000. Now, starting in 2027, January through December, the range will go up, and that will run anywhere from $250,000 to $350,000. As I stated, 2 budgets will be required, that they be submitted with the proposal. Incomplete budgets and failure to submit 2 budgets will also knock you out of the round. So that's all, of course, in the RFP. So we're very clear. The initial contract period, again, is August 1st to December 31st. And I know it's redundant, but sometimes people then will ask me again. And it will only cover the 5 months of this remaining year. And the period after that will then go into the full annual year. And that anticipated funding for the full 2027 is $875,000, subject to the appropriations of the city approval, of course. Now, there's this distinction between the first year and the annualized year, and that is that in the first contract period, you may use some of this funding to support one-time startup costs, so that will not be able to use following years. So it can be for staff recruitment, hiring, training around breast, cervical, colon cancer, clinical workflow development as you work together with partners that are in the health centers, developing standards of operation for some CBOs, setting up databases, and the health centers maybe refining their electronic health records to interface between the CBOs. So that is distinct from most of our RFPs and certainly from our previous programs. And keep in mind that startup expenses may not exceed 35% of your total operating budget. And again, I have to emphasize these startup costs are limited to the initial contract period of only this year. And then beginning in January of 2027, all funds are to go into program operations and service delivery costs. Again, nothing here I'm saying is not in the RFP. Everything I'm saying here is also in the RFP. But we'll share this, we'll post this presentation for people to look at. These are just overall program activities that we want to just emphasize. Again, that your proposal include evidence-based patient navigation, focusing on the priority populations, which are in Appendix A, and make sure that you present a patient navigation model that is coordinating with health systems and community as well. I would reference the 9-principle framework described in the RFP, and we actually included a reference page as well in Appendix B for you to take a look and see if anything would be helpful for your proposal. Again, the priority populations are African American, Latina, and low-income women, and all services should be provided to your population regardless of insurance status. And the big thing about this program is that we're really focusing on it being comprehensive and taking a continuum of care. So from screening, from educating out in the community, to screening, to diagnosis, to treatment, to closing the loop. So that's what makes this program a little much different than our previous ones. A work plan must be included, and I've just put out an example to remind people that your work plan must include your program outcomes, which we have also included in this RFP. And this is also very distinct from previous RFPs around our cancer prevention, is that we've put all of the specific KPIs and objectives that we absolutely want you to provide. They're broken down around the actual different cancer screenings. You have your breast, you have your cervical, and you have your colorectal, so that you can see it in a very a clear way, so there's no confusion as to what we are expecting from everybody here. Staff requirements. These are city Chicago's health staffing requirements, rather, and there is a hourly wage that must be met, and that is in the RFP. So you must also include any subcontractors as well, and describe all the roles and the positions. I don't think this is anything new to anybody here. Your submission requirements, your proposed project plan, your staffing plan, budget, and demonstration of the alignment with the CDPH principles. I think I know that in the actual RFP that you're all seeing, there's actually very specific questions, and if you answer the questions, you will answer these components. Fiscal capacity, we want to make sure that people have experience in being able to actually receive money from the city and be able to spend it down, have strong oversight of grants, experience. That could be a lead agency, not necessarily, it doesn't have MBO or the FQHC, although usually it is, but not necessarily. I know that the hectones out there in the world that actually do this very well for CBOs. But all of this is really important because we want to see that you are a good steward of our money and that you know how to actually manage a grant and provide invoicing in a timely manner. Insurance requirements of contractor. You have to have all these type of insurances if you want to play with the city. You will also provide proof of insurance. Now, when you put, and you have to put, it's part of the insured, it's to say City of Chicago, not the health department. Sometimes we get that. We want the City of Chicago as an insured party. So that is a requirement. This RFP, this program will have monthly program reports that will be required, vouchering on a monthly basis once we get you all up into the system. And obviously you will participate in any and all sponsored visits, monthly and quality assurance meetings, of which there will be plenty at the beginning, as this is a new program and we want to make sure everything is being run well and that we're supporting you all as best to make this a success. This goes to the iSupplier. So I always tell people the very first thing you should do after you get off this Zoom call is to make sure you have an iSupplier account, because without it, you will not be able to do anything with the city. You will not be able to submit an RFP. We do not take paper RFP proposals. That was like decades ago. They haven't done it in a while. And so this is the only way you can actually submit a proposal. If you have any issues with IT stuff, Daphne and I are not IT, but we can direct you in the right direction. So, like I said, first thing is to make sure that you have a city vendor account. Now, for those of you who have never actually had a city vendor account, you should be aware that the email, once you register, it can come as it's like a wonky address. So it may not be, won't say City of Chicago. So I'll actually look to see what it says. It doesn't say that, so sometimes people miss it. So I'll actually put that on there, what the email says. Okay. And now our contract union has been very wonderful, and they've actually put more support lines so that you can get e-procurement help for your iSupplier and delegate agency questions. So keep evolving and improving. This just shows you the score of the evaluation criteria, which you're going to be scored against. Every point counts. People say fiscal capacity. No, this too, who cares? No, every point counts. I imagine this is going to be a very competitive round, and agencies are going to apply. So just be aware that this is what we're going to use. The bulk of the actual points are in the program description. We're hoping and looking for rigorous work plans that incorporate all of the requirements. The deadline for questions is the 18th. So where are we? 2 days from now at 5 p.m. So any questions you have, you can send to me or to Daphne. And then what we'll do is take the responses and we'll put them and they'll get posted along with the RFP, and then we'll notify you that the questions have been answered so that everyone has an opportunity to see the question and the answer. The proposal is due July 13th at noon. Note the time, noon, not 5. but noon. There will be no exceptions made. I know people have called me and said that their computer stalled, and I actually know it does stall, and things happen like that, but I can't help you. Literally, the system closes, the city shuts it down and will not let anything through, and it will not open to accept any additional proposals. Like again, you can send any questions to me and to Daphne, who is we're at the last page. And there you see is, allow 3 days for you to complete the registration for iSupplier. So I think that, there we are, our email and our phone number. Now, I'm going to tell you the best way to ask questions is through email.
So you got a couple of questions in the chat, Bernice.
Okay, let me see. I'm going to go to the chat now, y'all. Let me see. Let me go to the chat. Let me go to the chat. All right. I don't know why I'm getting this strange box in my thing. What's the question? Oh my God, there's like a box here. Let me minimize it. I gotta move it around.
Can a public entity apply?
Anne-Marie, this is your question. What do you mean by public entity? We're public.
Well, like U of I is not a not-for-profit, it's a public.
Oh, yeah, they can come. They can apply. Yes.
So it's not-for-profits and publics.
Yes. We should have We're gonna adapt that. Okay.
Are these no-cost extensions or funded extensions?
There are no extensions on these funds. I'm sorry, I was remiss. I should have told you the funds are corporate funds. So there are no extensions on corporate funds. They run through the end of the year, and what is not spent goes back to our city coffers, and you start from the, whatever balance you have in 2027. So yeah, we don't roll over any money. I know that's a grand thing, not at the city. Not with corporate dollars.
So they're funded extensions.
They're funded extensions, you're right, but not rollover. Yes.
Given there isn't a current colorectal program, is it the healthcare partner who has experience with this navigation?
Yes, exactly. The partner.
That was the last question in the chat.
And your colorectal, I saw you're not expecting lots and lots of colonoscopies. It's fit kits.
Fit kits, exactly. Education, awareness, providing fit kits with but not the colonoscopy. No.
Unless, of course, the fit kit comes back positive.
If the fit kit comes back positive, then we're still not covering the cost of the colonoscopy. That's like thousands and thousands of dollars. So no. Good try, Anne.
So you just got to hope that whoever you found actually has insurance.
Well, then the patient navigator would navigate someone into the system, and if they're,
Which system?
well,
There's no system
the
for
partner.
colorectal.
Well, there you go, Anne-Marie. The ship is between the CBOs, and a healthcare system partner, so that they are able to educate and then get individuals into screening and then hand them off to, let's say, a patient. You start with a community health worker, patient navigator, of which you're very well versed in it, and then they're in the system, the health system. Like, let's say it was in Cook County,
But there isn't a good system for colon. There is for cervical and breast. If you find a patient there, you can always navigate them through IBCCP. But for colorectal, if you have a positive fit, you're going to be a bit stuck. Because like hospitals don't have to take someone for a free colonoscopy. They have to take you if you're in the emergency room, but they don't have to take you for a free colonoscopy.
Let me look into that, Anne.
Not to
into the
just
cost of
cause
that.
trouble, but
No,
we
that's
kind of
what you
need a
always do, though.
program for.
That's not a bad thing. Let me look into that one, okay?
What
Any
part are you
other
gonna look
questions?
into? I'm sorry, Ms. Tao, what part are you gonna look into? Exactly.
I'm going to look into the cost of colonoscopy and then see if that is something that can be included.
Wow.
Mm.
Great.
But it depends, you know, if it's a lot of money. This is about prevention and screening. The idea is that the health system that you're working with, the hospital, let's say Rush, would be able to see some of these people.
Yeah, though they don't have to. Like the challenge is you wouldn't really want to screen someone and then say, oh, you know, you could have colon cancer and you're gonna.
No, you're right. Yeah. Yep, you're right. No. So let me look into that.
And
And
I
then
don't
just
know,
to-
like maybe Abigail maybe knows like what % of fit kits come back positive.
Actually, I don't know. I don't know that off the top, but we're definitely working on that. In terms of understanding that.
And then do they necessarily have to be fits or any sort of colorectal cancer
No,
screening, including
no,
the
if you-
Cologuard
if you-
and
No, if you see the Cologuard and such, if you see those, if you read the RFP, it's different types. It doesn't have to be that. And also
Yeah.
in our
Only 'cause you say-
KPIs, in our KPIs, we're not saying that you should screen thousands and thousands of people. It does actually give you the specific metric. So the numbers are not large around the colorectal.
Mm.
Again,
Well,
this is
1,000 navigated. I mean, they don't all have to be colorectal, obviously, but.
correct, exactly. So one of the things that we've talked about, and I have with other people who are who have been providing breast health, is that they said, well, we'll want also to provide comprehensive care to our women. So we'll ask about cervical, and now they're asking about colon. So it's to open up that opportunity so that you have this woman who's there for breast or maybe cervical, and then you actually ask them, will would you also like colon? Now, so that's a really good question, Emery, around the cost, but also to see how many of this, the number is small. Again, this is not a large amount of money, but it can do a lot of, can have a big impact around the education piece. And not that everyone that you educate is going to run out and even get a breast cervical, but they could tell their loved ones like you should, and they could be insured. So this program, the previous program, for instance, for the breast health, it educated thousands and thousands of women. We did not screen thousands and thousands, but because we know that a lot of the women they educated have their own insurance, and then they can go talk to their doctors about it. So that's, prevention at its finest is to educate and activate and then get people to get screening. And those who fall in the window of being uninsured, then we are trying to help.
Right.
Sylvia, what's up?
Abigail.
Oh,
It's
God.
okay. I know, it's okay. I get that a lot.
Abigail.
That's funny. Yeah, I was gonna ask you about the 10,000 women that need to be educated. Do we need to follow those women prospectively?
No.
Okay,
Mm-mm.
I didn't think so. It was like a touch point sort of thing. Okay.
Right.
And then we just needed to confirm that the 1,000 that are navigated doesn't have to actually come from those 10,000 educated. They might, but since we're not following them longitudinally, we're not gonna know that.
Right. They don't necessarily, but if you knew that, then that would be, that'd be great.
Yeah.
Anyone else have questions? You don't have to ask all the questions now. You have 2 days.
No, I
No,
need
and
to
then
find out.
sorry, and clearly in terms of the geographic target populations, it's a matter of it's showing that it doesn't have to be 100% of the people that are the 10,000 and 100% of the right. That's what I figured.
No.
Mhm.
No, we do want to see that you have, you have experience, that you understand the need in that community, and to be able to educate those women, because we know that they're not all in just those communities, and women go out of their communities for care, I go to Oak Park, so yes, but we want those communities to have focus and opportunity.
And another question I had, sorry, she was my hand. The other question we had was about those metrics, the 1,000 navigated, the 10,000 educated. Is it like per year or like during that period of time?
Okay, yes. So that is per year, so it won't be for the month, for the 5 months, so I will, 5 months, adjust. Yes, that is per year, but obviously that's not going to be for the 5 months because you'll have startup and whatever, so I will adjust and put up that information ASAP. Good catch, Abigail.
And then Bernice, in the past, we've had 2 separate RFPs, one for screening and then one for services. Is this year just going to focus only on the navigation screenings, or will there be a second RFP?
No, this is it. Now you can include the costs for mammogram screenings. You're like, let's say you are you partner with a Rush, or in your case, UIC. Let's say as CBO partners with you, they have community health workers, they hand them off to you. You provide patient navigation. Some of the women don't have, they're underinsured or uninsured. So those costs for the mammograms can be charged to the program.
Okay, so the screening could be charged.
Screening,
but nothing past,
the
like,
mammogram screening.
Okay.
And
so nothing
diagnostics too?
And diagnostic, yes, because as we know, a lot of women of color, and I'm old school, and I'm brown, and I use that term, when they show up for screenings, they're beyond that, and they just need the diagnostic. So this is historical knowledge and experience that we've ascertained from our programs during the last 8 years, that sadly they need to go to diagnostic, and the screening is not an option for them anymore.
Yeah, they might start as a diagnostic, but if they came in as a screen and they then needed a diagnostic and they were uninsured, you could pay out of your money using the IBCCP schedule.
Yes, using the IBCC schedule. Yes.
Okay.
I'm going to make
And this
sure
goes
that's
all the way
clear.
up until biopsy, correct?
Well,
Or
we've only just done the screening and the diagnostic.
Well, for colorectal cancer, though, right, it could be both, right? The diagnostic, well, you're right, the screening also could be like treatment, really, in some ways. But okay, I think I get your point.
But I'm going to flush this out and I'm going to put it on so that's clear.
And for the colo, for the fit kits, is there an amount that's an allowable amount for billing for those?
Daphne, what was the price you were seeing?
When I looked at an individual price. I couldn't get a group price. I called to speak with a representative, and I think they were like $200 or something like that. But if a person has some form of Medicare, they could receive it for free. So I would have to go back through my research when we were looking it up. So depending on what they have, Medicare A or B or Medicare period, they could get it for free.
Or Medicaid?
For Medicaid, she said, yes. So
Medicaid.
Uninsured, yes.
Yeah. But then presumably we'd run into some people that would be uninsured, so then we'd be, and I don't know, I'm sure the clinics, I'm sure Mile Square and other FQHCs could tell us how much their fees are for an uninsured.
And they may not even use the fit kit, they may use the color guard. So it depends. And this is why this is why the model is about partnerships between community folks and health systems, or I call them generically the health, from a FQHC to a hospital. And it doesn't just have to be like just an FQHC and a CBO. It could be all three. It's whatever the partnership you bring together to cover all your needs. And so that you bring in different knowledge. There's not a CBO there that necessarily, a CBO out there that would have clinical experience, but they will partner with someone that does have that clinical experience, vice versa. Not an FQHC that has the inroads and all the experience in this community the way a CBO does, that has a focus on health. So this is why, and this is the models that have been proven to succeed. So you have to lean on each other for some of this information and the costs.
For um for cervical screening, the RFP mentioned PAPs, but are we also including the self swabs as a form of screening, or are we not?
They were just pap smear screening.
But you can get a pap done with the self swab in essence. Because yeah, as you know, there's people that are very reluctant to engage in PAPs, and the swabs are just as good.
So I just
Is
checked.
that a cultural
sorry.
reason that someone would not want the full swab then? The full
Yeah, there's
pap
cultural
smear?
reasons, there's gender identity reasons, there's
Ah.
lots of reasons.
All right.
Convenience, honestly, for some folks too, so.
Okay. So let me add that. Paolo, what did you call that?
The self swab?
Cell swab. Cell swab. Okay. Okay.
They're an excellent way to get to hard to reach populations that are very reluctant to get regularly screened.
Well, you guys are the experts, so okay. I'll add that, okay. Other questions?
No, I'll just tout that U of I is at the forefront of pioneering that.
Oh. Nothing else? Okay. Well, as you know, you have 2 days. Contact us, email us with your questions. I'm going to ask, are you all already a nice supplier here? Do you know?
Well, I'm
Yeah, I
representing
see.
Wellness West here, and so I don't know if they're on iSupplier.
Okay. Well, make sure you get on iSupplier because these responses and updates, I'm going to make some in terms of information will be posted there.
Okay,
Okay.
Grant.
All right. Well, good luck to you all. So we're clear after the 18th. Yes, the 18th. Daphne or I can answer any questions regarding the RFP. We can only help you if you are having some IT issue getting on or whatever like that. We cannot provide any more questions, any more answers rather to RFP questions. So, because it's the rules. So, and we abide by them here. So make sure all your questions, you can have a whole bunch, but after the 18th, none. All right. So good luck. The attempt again, best foot forward. Every point counts. Okay. As I tell everybody. Good luck to
All right.
everyone, and I look forward to receiving your proposals. Thank you for
Okay.
all the great feedback too.
And these slides, where are the slides going up?
Well, we're gonna put them as well as part of where you find the RFP. Where you found the RFP, we'll make sure you get it. Don't worry.
And then
Okay,
we'll hear
great.
back from you, Bernice, on any updates for those payments, or where will we have access
That
to
will
those?
also be, yeah, because I have to make some updates. Yes.
Okay.
Yes. Okay,
Great.
All right.
super.
Thank you.
Okay.
Thank you.
Good to see
Thanks,
you all.
Denise.
Bye.
See you, bye.
Bye-bye.